I'd like to now take you through the process of actually collecting cord blood. It's a very easy process, and I'll take you through step by step. This is Stork's cord blood collection kit. It looks like a mini igloo container because it is a mini igloo container made specially for us. What's most important is that the cord blood is kept at room temperature, and that's why we wanted to use good insulation. The other thing is we wanted to make certain that there was no possibility of crushing the contents, so we have this strong container that would be resistant to that. In addition, the cord blood container has a locking mechanism so that no matter what you do with it, the top can't come off. And what we'll do is we'll start going through this. So I'll press the button to open the container. As you can see, it locks back in place. And we'll go through each step. The first piece of paper inside the kit is actually a step-by-step instruction guide on how to do exactly what I'm telling you today. So I'll put it down next to me to make sure that I don't forget anything, but it makes it very easy to do this. At the bottom of this is a list of the supplies in the kit, and the top is step-by-step instructions. Also in the kit, as far as paperwork, is a consent form to allow you to do this procedure. This is a consent form that your clients have signed on behalf of Stork that release you from liability and release Stork from liability for doing this procedure, saying they want to get it done. So both of these will be in every kit. Now, getting to the process itself, one of the requirements from the FDA is that we have a sample of mother's blood. They want to be able to make certain that the mother has not gotten any contaminants, such as HIV or hepatitis or whatnot. And this has to be done within a few days of the pregnancy. Usually it's just done at the same time that the mother's going to give birth, within hours before or hours afterwards. In any case, we have the supplies in here. We have 4 tubes, and I'll pull them out of their little secure container. This would include, at this point, 2 purple top tubes and 2 red top tubes. Now, this changes from time to time based on FDA requirements, so this will be listed on the instructions, and if the number of tubes or the color of the tubes changes, we'll be happy to change it on there so you don't feel uncomfortable. Of course, we'll eventually change the video if we have to. And in a separate little envelope, we have all the supplies to draw mom's blood. This includes, of course, a tourniquet, alcohol prep pad, a needle, and the hub for this. And so once the needle is inserted into the hub, it just is a twist on, and you have pulled off the needle so we can expose it, and this has gone in to mom's arm. All you have to do is take this tube and push it down on top, and by vacuum, blood will go into the tube. You've probably done this many times in your lives, but I want to make certain that everybody's getting the same information. Fill the tube as much as possible because there are a number of tests that have to be taken, and if these tubes are half filled, then we cannot get all the required information and sometimes have to do it again. And so it's nice to get it done the first time correctly. So we'll put those aside. The next piece is really having to do with the collection of the cord blood. As I mentioned to you in other videos, you can collect the cord blood while the placenta is still in utero, or you can collect the cord blood after the placenta has been delivered. If the placenta has been delivered, then you have to move a little bit faster because we have to get the cord blood before the blood actually clots. And so that's really the difference. But either way is acceptable. So in here, we've got a number of different pieces. I'm going to go ahead and take them all out of the container. Eventually, everything will go back in the container so that our courier can pick it up and deliver it to the laboratory. In here includes a large storage bag that you'll put the cord blood in. That just protects the courier from any contaminants, any little blood seepage that may occur. It looks essentially like a big Glad bag, but it's a specially made bag for biologicals. And on the outside will be a label with the identification code for the sample. The major event, of course, is collecting the cord blood. This is going to come in a sterile envelope. On the outside of the envelope, you will see the same kind of label that's on this bag. And what we would like you to do, and very important that you do, is you take this label and you'll attach it to the cord blood bag. We can't do this in advance because, of course, the sample is sterile at this point. So simply take the label off, and you will see that there's a notch on the side of this silver envelope. You'll open it up, and inside is another sealed container, again for issues of sterility, that comes out. Now I'll point out on the outside of these yellow bags, or these foil bags, we have a sticker that just reminds you, the more cord blood you collect, the better off we all are and the bigger smiles we get. So we just want to encourage you to get every drop. Inside that full bag is another plastic bag. You'll open this up, and you actually have the cord blood collection bag itself. It is on this bag that I'd like you to take this label and attach it, so I'll do that right now. So we're all set. Now, of course, this doesn't have to actually be sterile, so this can be done in advance of the delivery. The only thing that we want to make sterile is to make certain that when you collect the cord blood, that the cord is actually clean. At the end of this cord collection bag is a needle that's covered, and of course you would remove the cover prior to doing that. I'll just put it on for a moment to protect myself. This bag actually has some preservative in it, and the reason why we encourage you to get every drop is because when you get a few drops in, it'll look like you collected a lot. But of course, most of that is preservative. So we would love to see this entire bag filled. Often that's not possible, but sometimes it is. In order to make certain that you have an easy way and a sterile way in which to collect the cord blood, we've included other components into this. This includes gauze pads, alcohol prep pads, and betadine. Those are also pads. And so what I would suggest is that you take a gauze pad, open it up, and again, this doesn't have to be sterile at this point, and you're just going to clean off the extra mucus and body secretions that are on the cord so it's easier to handle the cord. You'll then take alcohol prep pads and you'll wipe down the area of cord that you're going to collect from. Now, there's a major point here that everybody learns in schooling, but everybody forgets as soon as they leave school, is that alcohol kills by contact, and betadine, which are in these pads, kills by drying. Now, this is critical because it means that if you choose to use betadine to begin with, and we hope you do, that you actually have to wipe betadine onto the cord, allow it time enough to dry, which is usually somewhere between 30 seconds and a minute, and then do it again for each layer. If you were to wipe the cord with the betadine, grab another swab, wipe it again, take another swab, wipe it again, and then take alcohol and wipe it down, the only thing that's actually cleaned the cord is the alcohol. Now, alcohol is very good, and in some ways it may be sufficient if you're at a time crunch. Sometimes you really have to race the clock if you're a little late in getting the placenta and it starts to clog. But the best practices would be to do a betadine swab on the area that you're going to put the needle in, allow it to dry for 30 seconds to a minute, do that 3 times, then open up 3 swab packets of alcohol wipes, and you can do those 1, 2, 3, and that can be done in 3 or 4 seconds. And that's just a special way in which to make certain that the collection you get is sterile. Every once in a while, we do get a contaminated sample. When we get a contaminated sample, it's almost always with a low amount of cord blood, which means to me that what's happening is that the doctor or the healthcare provider is rushing through the process. They want to get back to bed, and so they have wiped it off real quick, stuck the needle in real quick, gotten a few drops of blood, and then sent it off. And then it turns out to be contaminated. Now, contaminated cord blood is still actually usable. We will have to pre-treat it before it actually ever gets transfused. Inside this care package also is a C-section adapter for those of you that do C-sections. On the other hand, if you want to use this just as extra extension tubing to make it easier to move around, then that's perfectly fine as well. And we have an umbilical clamp. After you've collected the cord blood, what we would like to see happen is that you tie a knot in the cord, in the tubing, that you've cut off the needle so it's not being transported, so that nobody gets poked in the laboratory. Okay, please do that. And that you would apply the umbilical clamp actually to the tubing itself. And this is just one extra way in which to make certain that blood doesn't flow back out of the pack after all your good hard work. So with that, you'll have cut off the needle. You will have taken your cord blood and put it back into the collection bag. Perfectly reasonable to take the tubes that you collected of mother's blood, assuming that they're full, and put them back in the bag too. Seal this off. Let a little air get out. Put it in the kit. Close up the kit. On the side, on one side, we have our toll-free number so they can call, and we'll send a courier any time of day or night, any day of the year. We never close. And on the other side is the information that we ask you to give to the person that answers the phone so that we know where to go, what the sample number is, and the time of birth. These are the things that have to be noted both to collect the cord blood and also for FDA specifications, because this person whose cord blood you're collecting could live to be 100 years old. So we have to have a number of pieces of identifying information so that it's stored correctly and that the right person can always find their sample easily, even 100 years from now.